Yay.
All right.
5.
Okay, this is our project for Health Science 480 on maternal mortality in India. I'm Jeff Despot.
Are we
I'm
in
Becky Lay.
There we go.
I'm Miranda Ramirez.
Perfect. And by this time we should have a video introduction given by Elaine Mukendi, who lives in South Africa. For that reason, he's not with us on this specific video. Okay, we're going to jump into our presentation here. All right, is everybody seeing that?
No.
No. Oh, there we go. Oh, no, wait.
All right,
No.
let me share the screen really quick then.
There we go.
All right. We'll get it. Now.
There we go.
Yes.
Are we there?
We're ready.
Yep.
Okay, maternal mortality in India. Our program focuses on helping pregnant women in India on how to take care of themselves, how to prepare themselves for possible complications that can go wrong while being pregnant, and in a country where this is a real problem for them. So our program implements many different things as far as a curriculum and a possible kit that we would send to these women, educating them and helping them to be more healthy and prepared to take on those complications. We'll start with the nutrition that we focus on in our program. A healthy diet is crucial for pregnant women and their fetus. This here listed is really the food chart. It's really the nutrition that we all should get on a daily basis, but it's that much more important for pregnant women. You need fruits, 2 to 4 servings a day, vegetables 4 servings, breads and grains 6 to 11 servings, proteins 3 servings, and dairy 3 servings. It's really important for women to get this nutrition because a simple prenatal regimen of supplements is important, but it's not enough. You can only get the nutrition you need when you're pregnant from eating a healthy diet. We move on to the supplements that are necessary for pregnant women, and it's understood that women in countries such as India may not have access to the healthiest of foods and all the nutrition that they need to stay at peak level nutrition and health, as well as for their fetus. So it's important that they get these supplements. The first on the list is iron and folic acid, and that's really important because in a country such as India, they have I believe it's a 58% anemia rate, which means they're having an iron deficiency in their blood, where they can't produce enough and don't have enough red blood cells in their blood. Iron and folic acid will clear that up for them. It'll make them healthier. Vitamin A is really important during pregnancy because it helps in bone strength. It helps in the reproductive processes and their development, as well as immune system health. So vitamin A is important as well. Calcium also is a help in bone strength as well as cardiovascular health for the mother and for the child. And then iodine. An iodine deficiency can be really something that's crucial and important to watch when a woman is pregnant. Getting enough iodized salt, getting enough iodine in the diet ensures good metabolism and reproductive growth. So that's very important. And then listed as other vitamins and supplements that are needed. Vitamin C and protein, crucial in any diet, especially for pregnant women, as that helps them with all the processes and functions of their body, as well as for the fetus. So this nutrition and these supplements are very important, and we would include these supplements as part of possibly a prenatal vitamin kit that would be provided, as well as these supplements and vitamins and this diet would be part of our curriculum that we would teach to them in their culture and how important that is for them. That would be presented to them as part of our program. We move on to medical issues and maternal health.
Yes, this is another thing that would be part of our curriculum. It would focus on some of the main issues that lead to maternal mortality, and that is preeclampsia, which is high blood pressure during pregnancy, and some labor and delivery complications that they could have, and also some postpartum complications. The first thing with the preeclampsia, we would teach them in the curriculum how to monitor blood pressure, because this is especially important during the second and third trimester. So those who we train will learn how to take the blood pressure and be able to read it accurately using the appropriate equipment. And if the blood pressure is higher than 140/90, they need to be concerned about that. And these are some of the signs of preeclampsia. Also, if there's protein in the urine, so we would provide dips for them to be able to check the protein levels in the urine. Also, if the pregnant woman has edema, or if she has persistent headaches, blurred vision, or pain in the right upper quadrant of the abdomen. And these signs would be taught to them so they could be able to tell the women who are pregnant about these symptoms also, and be able to notify the midwife or nurse attendant or whoever has been trained in the village to help them, and they could get treatment for this preeclampsia so they don't end up having more complications. The other thing during labor is the fetal presentation. When they go into labor, it would be important that they check and see where the head is of the baby, and also be able to know if they haven't previously found out what the size of the baby is. So if they've been able to use an ultrasound previously, if they have like a handheld ultrasound or something, that would be ideal for them to see this. But when they go into labor, the Leopold maneuver would be taught to these midwives, so they could use this to feel where the baby is, where the baby's head is, and which way it's facing. Because if the baby is breech, or not in the right orientation, or if the baby is too big, these are things that can lead to maternal mortality, because the mother will have a very hard delivery and may not even be able to get the baby out. So in these circumstances, it would be recommended that the mother make her way to the hospital before, because if one of the problems is getting them to the hospital on time before they've hemorrhaged too much and they die on the way to the hospital. So if this could be figured out beforehand, they would have a better chance of getting to the hospital in time. And also they would need to do the cervical examination to see how far the mother's dilated. And then, as I mentioned, the postpartum hemorrhage is one of the major complications that leads to maternal mortality. Once they're hemorrhaging and they don't have access to any immediate health care to be able to stop it, or to get any transfusion or anything like that. So it's important to be able to treat this as best possible. And some of the things that can lead to the postpartum hemorrhage are cervical lacerations, or the placenta not being completely delivered, or when the uterus doesn't contract back. So some treatments for this that would be taught to the women is how to repair the cervical lacerations. This would probably be for someone who's more skilled, like a midwife or something, that they would be able to stitch those lacerations up. Or if they don't have that kind of training, they would be able to apply pressure to the cervix, pack the vagina with as much as they can to just put pressure, like you would on any kind of a wound, put pressure up on the cervix so to help with the bleeding until they could get more emergency help. Another thing is to massage the uterus, because that helps it to contract and helps with the hemorrhaging. And another thing that we found out is that you can use a suppository in the rectum as soon as the baby is born. That could be inserted even just as a precautionary thing, because it will help the uterus to contract. And we found one that doesn't have to be refrigerated, which would work well for these areas in India, and that is called misoprostol. And we would provide these to the people in charge so that they could give them to the women when they go into labor. And as soon as they've delivered the baby, that could be inserted.
Okay. To get all of these things going, we figured we would need some equipment, and this would be the basic equipment that would be necessary. Stethoscope, blood pressure monitor, thermometer, measuring tape to, teach the women how to measure the belly to make sure the baby's growing at a good rate, or if the baby's getting too big, that maybe that might be a concern also. Flashlight, gloves, antiseptic wipes, alcohol, hand sanitizer, clamps, masks, scissors, and maybe a glucometer and like test strips and lancets and testing supplies if there might be a risk of oh goodness, now I can't think of
Gestational diabetes.
gestational diabetes. If there might be a risk of that, then it would be nice to be able to monitor that with the glucometer and supplies. So if we are able, well, we would like to be able to train some women to be midwives, and they would require a few extra things. A movement indicator of the baby, a fetal heart monitor, some of those things that ultrasound, handheld ultrasound machine would be nice. If during delivery they would need umbilical scissors, a cord clamp, gauze, lubricants. There was smelling salts was on there, syringe, receiving blankets, and the blue bulb syringe for the baby, and heating pad if available. But this would be the basic equipment needed just to, I mean, if there were complications, this probably wouldn't be the best, but then hopefully too they would recognize those complications and be able to get medical help quickly enough that they wouldn't have to worry about that. So this would be at least a basic supply list. Okay, and those are just some pictures of some of the things that we would like to have up on the left-hand side. You see some of the monitors and machines that could be, handheld machines that could be used out in the field and not require too much lugging of things, syringes and things like that. So that's just a little picture of what might be necessary. Okay, now Becky talked about maybe who we could recruit, and because it is the customs and the traditions in India are a little more strict as far as strangers or outsiders, having access to the women or touching them or just being there at these times. These are kind of private things, birth and pregnancy, so they might not be too open to having random people touching the women or being involved in these areas. So what we would ideally want is for maybe some of the older women in the community to volunteer to be trained, maybe even certified as midwives, but at least to have training in the basics of care. So even just learning how to take blood pressures and maybe the urine samples with the dip tests, that would be something that they could do. Weight, just taking weights and recording things like that, using the measuring tapes and things like that to just be able to kind of keep track of how the pregnancy is going. And I think ideally it would be the women in the community who would be involved in this. And I would think that maybe the older women in the community who have already had their own children and now have grown children and really aren't in their childbearing age anymore would be ideal. We did do research that says that a lot of times the mothers or mother-in-laws or the husbands are in charge of the medical care. So if they would trust these older women to help them and take care of them, then that would be great. So what we would want to do is train these people at least in the basics of care, like the blood pressure again and taking weights and measurements and stuff. And after that, if we could certify women in midwifery, then that would even be better, and they could actually help when it's time for the baby to be born. Um, we would like to register all the women who would be willing into this program. The women in the community, if they'd like to register, could come to us, or we could hopefully seek them out. We would like to arrange home visits where, especially toward the end of a pregnancy, when it's harder for the woman to get out, or when, or if there are complications or things where bed rest might be needed, then we could do home visits. But also we could maybe provide a clinic 2 or 3 days in the month when they could come in for exams and checkups, where we could keep track of how they're progressing, record their vitals, and if there are any concerns, or if there might be complications, we would know to send them to a hospital or to a doctor for further care. We could provide prenatal classes, and again, like Jeff had mentioned, nutrition. Becky had mentioned, I think, warning signs they should be aware of, and of course, we could do some breastfeeding or early childhood nutrition, or early childhood classes, so the women maybe would have some ideas of things they could do early on for their children. And again, later in pregnancy, maybe offer some home visits where a midwife could go over some things that the pregnant woman might expect during her labor, and just prepare her for that. And then hopefully when the time came, she would be able to call a midwife and have her come out and take care of her, and hope if things were progressing normally and there hadn't been any complications up to that point, a midwife would definitely be able to deliver a baby safely in a home. Let's see, and if we were able to, I think after the babies are born, I think it would be nice for us to be able to offer some basic child care classes, just because those first 2 years of life are very important, and that's when the babies do their most growth and development. So helping women in that stage would also be very important, I think. So basically, we're trying to get the women in the community involved so that it wouldn't be strangers and outsiders taking over during this kind of a private time for these people who don't really want someone poking around during a pregnancy of a woman. And I think they're private and very modest people, so I don't think they really would want someone who is a stranger to be looking around when it's this kind of a time. So this would be our goal.
All right.
Yep, so our final goal is to have a healthy mom and baby at the end.
Yep.
All right, I'll pull back up our screen here. We have any comments or anything else?
I think that's good. That's the end
All
of our
right.
presentation.
That is our presentation. I think we did okay on time, right? It's in there somewhere. Okay. Good job, guys.
Awesome.